Hello, this is Dr. Stanley Lang. Welcome to this video. And the purpose of this video is to give an occasional update on some things going on regarding the coronavirus infection. And what I intend to do is occasionally post a video that is related to something that I'm learning or relearning maybe. And the topic that I wanted to address today was using face masks, whether to use them or not. And the reason I want to focus on this is because there's so much in the news that basically says wearing them doesn't work. Now, for a lot of people, it doesn't make sense because something that is blocking the very particles that people say the virus is embedded on, that seems to make sense that would make a difference. Why would there be this difference in opinion with different specialists saying it doesn't make a difference, when whole societies like certain parts of China and other Asian societies are wearing these masks basically all the time. And in Singapore, they also wear these masks whenever there's a big risk. So I've worn these things for decades and just sort of accepted the idea that the main purpose for them was to avoid giving germs to the patients that they're operating on. So the way that these are constructed, if the surgeon would cough or sneeze or something, it would kind of catch the air before any particles would go into that field. What they don't do, because they're not tiny enough, the filter is capture viral particles on their own. So they don't, like if a virus was all by itself floating through the air, the gaps in this are too great to be able to capture those viruses. Now, most of the people that have been talking about coronavirus infections have been talking about it being the virus being embedded on droplets. Now, if it's embedded on droplets, that's how people catch it, then this mask actually would help, because this is the gaps in the mask are not so large that it would not capture tiny droplets. So I went to the literature and actually did some research yesterday, because I had just sort of accepted what I've heard everybody saying, that these help to prevent giving infection, but don't help you in terms of avoiding infection. And there is some research out there that actually shows just the opposite, that that when the mask is properly worn, that it does create enough of a barrier that if the thing that's coming at you is in a droplet form, it protects you. So what you'll hear on the in the different places is that, quote, there is no evidence that this mask protects against infection. What you won't hear is that there's almost no research done in a clinical setting. It's just more of a common sense strategy. But the research that I found was very much set up to mimic live setting, and droplets were coming back and forth, and it actually showed that it did protect. Now the problem, and I think one of the reasons that people are being discouraged from everybody going out and buying masks is that there's not enough masks. And so there is a question of, well, where's it most likely to do me good? Well, it's most likely to do you good if you're around somebody that is sick. So if that person is sick, wearing this mask would have a chance of helping you. Now, there is this phenomenon, like in people that have influenza. People that have influenza and have been people that have influenza and they've been immunized against influenza actually breathe viral particles out without any droplets. Those viral particles would go right through this. But as far as we know, the coronavirus infection isn't spread that way. It's spread with droplets. Well, the droplets would be caught either coming in or going out. And so I think that there probably is evidence for help, but whether you're trying to protect yourself from spreading it or trying to protect yourself from getting it. But I would also recommend prudence, because there's a very limited supply of these things. So going through a bunch of them when you're at very low risk of encountering somebody, that's probably a waste given the circumstances. But if you're around somebody that is sick, I do think that it's prudent to wear one, because as far as we know, these things, this infection is spread with droplets. So I hope you found this reflection helpful. I hope you stay well during this coronavirus infection. God bless and have a good day.